Welcome, and we would like to call the meeting of the Rutherford County Benefits and Insurance Committee to order. And the first agenda item is to address the approval of the minutes of the last meeting, of which you have a copy. Do we have a motion? All right, a motion, a second from Ms. Boney. Did anyone have any additions or corrections? If not, then all of you in favor of that, please say aye. Aye. Any opposed? Thank you very much. Now, Ms. Stinson, give us an update on our financial condition.
I have before you Fund 264 pertaining to June and July of 2014. June being the end of the fiscal year, I'd like to report on that separately. For the month of June, our per employee per month for our self-funded claims ended at $1,064 compared to prior year of $641 for a year-to-date average of $874 compared to prior year of $803. When we combine the on-site medical experience, our total per employee per month for the month of June increases to $1,140 compared to prior year of $680. Our overall year-to-date average per employee per month ended the fiscal year at $913 compared to prior year of $839. Moving on to the month of July, we've began this fiscal year with a per employee per month self-funded claims experience of $848 compared to prior year of $885. When we combine the clinic experience, it increases to $853 compared to prior year of $890. For Fund 266, ending with the fiscal year of June, our year-to-date was $2,045,738 compared to a prior year of $767,385. In the month of July, we ended at $90,939 compared to prior year of $44,509.
Okay, that's her report. Do any of you have any questions about this? We have had almost a 9% increase last fiscal year over the previous.
Yes, on the medical, that is correct. And some of that cost was contributed to the implementation of the biometrics, the increase in cost related to that. I did look at our claims spend recently to see if our clinics were still trending well, and they were actually still trending below cost for a private practice appointment. So there's a couple different things that we look at in our spend rate, and individually there were a lot of positives.
Okay. Anyone have any questions? Do we need to approve that, Ms. Anderson? Okay, then we need to approve the financial report. Do we have a motion? No, she said no. Excuse me. I should have checked our minutes. Okay, so that's that report. So we'll move on then to the workers' comp and OJI report, and Mr. Good is here to give us that information.
Good afternoon. I'd like to report for the month of July that we had a total of 12 injuries requiring medical attention, and you'll see the breakout there on your report. That brings the total for the year up to 118. Of that 118, 65 of those injuries were recordable under OSHA standards. 43 of them had restricted days. 13 actually had lost days, and 9 were all others. Next page of your report, you'll see that the total dollars incurred for those 12 were $15,320. And as you look at your graph there, you'll see where we are this year with the line compared to the 2 previous years that are shown in bars. And right now we are up slightly, however, as far as the claim count, but as far as the dollars are concerned, we are down at this time. Of the 12 injuries, 3 of them were with the Board of Education in the month of July. Total dollars there were $2,500. The remaining 9 were with the county general. Dollars there incurred were $12,820. And then the next page of your report, you'll see that those broke down. Sheriff Department had 7 injuries, and the ambulance service had 2 for the 9 in the county general. And then the last page, of course, is reflecting the total dollars incurred again this year in the line and the 2 previous years in the bars. Are there any questions at this time?
Questions for Mr. Good? The trend is reasonably good and stable, is that correct?
Yes, sir. Thank you.
Thank you very much. Moving to agenda item number 4, wellness update from Ms. Perrion.
Good afternoon. I'd like to give the report for June and July. Lori and I have been out and about a lot this summer. We have gone to the new hire Board of Education meetings, the DI conference, as well as the Rutherford County's Farmers Market, and we've talked and touched to about a little under 600 employees. 200 of those are new hires, and what we've done there is try to drive them into the clinics initially, and we've done MedPoint promotion, talk about the services that are available there, and trying to increase participation on the wellness challenges that we offer. And we also went to the principals meeting on the 23rd of July and talked to them about the Wellness on Wheels program and asked if we could come to their schools. We have scheduled Wellness on Wheels for all of the schools as well as all of the county general departments. So we'll be doing that we've started in August and we're going to go through May. For the individual coaching for June and July, June had 3 initial visits, 13 follow-up visits, and July had 2 initial visits and 25 follow-up visits. For current and upcoming programs, we're doing the Zensi Online. That is something that we are talking about at the Wellness on Wheels tables, as well as the MedPoint services. We have an Each Wellness Challenge for Nutrition Month to eat more veggies. We're partnering with UT Extension Office for that program. Our webinar from Life Services is Caring for an Aging Relative. It's on September 16th at 11 or 1 p.m. Our walking program starts in October, and we're going to do the kickoff at the Wellness Fair. The annual Wellness Fair is October 17th this year at the Community Center. And if you'd flip over to the back, I just added on like the year numbers for the individual wellness coaching at the clinic. Lori saw 69 patients last year with a total of 234 visits, averaged at about 3 visits per patient. Anybody have any questions?
Yes, sir. Ms. Barnes.
Correct, maybe Melissa. This is about the flu shot clinics. Will you send out something soon giving us dates about the clinics?
We do have the flu shot clinic dates, and it's going to open at the Wellness Fair like it does each year. So it's going to start on 10/17 at the Wellness Fair. The schedule is being printed and included in the open enrollment materials.
Open enrollment materials will be released, and they're going to press, and on Tuesday. They should be out in the mail within the next 2 weeks. They will be in home mailboxes prior to the beginning of our Zensi training within the school system, which begins on September the 16th. For County General, those trainings begin on September the 18th, and there will be that schedule inside the open enrollment materials as well.
So, Ms. Perrion, for those of us that are not up to date on this, give us a brief overview of how does this wellness coaching happen? Is it do these people want to participate, and tell us what it consists of?
The individual coaching is they call MedPoint and schedule an appointment with Lori Cook. She's the wellness specialist over there, and they focus on what goals that the patient wants to work on, and so some people work on their diet or nutrition, some people work on weight management, some people work on their exercise program. She also has a degree in exercise physiology, so it just kind of varies by the person, and they can just call the clinic and set up an appointment with her.
We've also seen an increase, Mayor, in our not only inside the clinics, but on our telephonic coaching that we do through Cigna and the Your Health First. Following the biometric screenings last year, we have seen an increase in both of those areas. And next month, I can provide you with more of an overview as to what we're seeing in results of Your Health First, so that you understand what is the end result of some of these wellness initiatives that we've had.
Well, what we're getting is the outcome we were hoping for. More and more people are participating in some of these wellness coaching events. Anything else for us, Ms. Perrigan?
Well, today. Thank you.
All right, Mrs. Stinson, did you have anything you wanted to add to that, or do we need to move on?
No, sir. I think that is all. I will say one more point on the Zensei. We have sent out FAQs, or frequently asked questions, to employees to help address some of the questions that we've had filter into our office. For those department heads in the room, I would ask that as you're being approached by individuals with questions, that you either send them to us, allow us the opportunity to speak with them so that we can glean what are some of the common questions and ultimately get that on the FAQ, or at least shoot that question over to us so that we can have that information as well, so that we can answer it in writing so that people can have it as a reference after they go to the training. We highly encourage all employees to participate in a training program with Cigna. They will be doing a presentation. If you arrive with your MyCigna login, you'll be able to complete it while you're there in the room. So anyway, there will be information in the open enrollment materials about that.
Okay, any other questions on that? All right, next is on the agenda is approval to bid on the on-site clinics that we have in place. So Ms. Should I call you Mrs. Street? Would you
I'm still
please
adjusting.
cover that?
No problem. Our current contract on the on-site clinics will expire on 8/31 of next year. We need to go out to bid for a 9/1 contract effective date. We are hoping with approval to release the bid at the end of this year, because it does take some time to send out the bid, get it back in, analyze the data, present it to you all. Ideally, they like to have 6 months lead time in the event of a contract change. We're going to try to get there as close as we can. So if we are just asking for approval to bid that.
Okay, so you just want consent from this group here to allow you to start the process of releasing the bid, you said, by basically the end of this calendar year?
Yes, sir, that's correct.
All right. Mr. Hall has a motion, a second. Mr. Jordan, now are there any questions? Ms. Harvey?
On that bid, will there be any extra or any changes that you'll have for the guidelines of what you want them to provide, services you want them to provide that we maybe are not receiving now, that we think we want to be receiving next time it comes, we get a new company or stay with this company?
Yes, that's a good question. One of the things that I have been in discussions with the current vendor is, and it will be part of the bid packet, our next step in trying to find alternative routes for care, for lack of a better way of saying it. We've expanded our clinics into the retail market to try to keep people out of the emergency room. We're seeing success for that. The next step in really the continuum of that is telephonic. And so, a doctor can contact you telephonically. Your appointment can be by telephone. Judges do it now. They use two-way screens, and there's different, not just in healthcare it's being done, but in healthcare it's been around for a long period of time. And so we will be asking for that to be part of the bid, so it will be an opportunity. We may actually come to you prior to next September and look for a way to infuse that into our offering, but it certainly is something that I'm researching right now and I've asked for a solution on. So that would be one more way that the clinics can have that contact with our employee population. We can have that central center for their health information to exist, so that if they have a phone call and they are prescribed medication and they need a follow-up, they would be able to go back into our clinics. They would already see that they had this telephonic service and this is a follow-up to that, so that you're not going to a retail site that's not associated with our clinics or your primary care physician, and then that doesn't work, and now all of a sudden you want to go to the clinics because it doesn't have any out-of-pocket costs or whatever your reasoning is, and you come in the clinic and we have to start over. We really want to be able to have various options available so that we ensure care is being received.
And I'm sure that they would be, if you have some suggestions, just forward them on to her and discuss them with her, and I'm sure she'd be happy to receive any input that would improve whatever we're doing. Any other questions on that? So let's see, have we done anything on that yet?
We had a first and a second.
We have a motion and a second, but we haven't actually voted on it. All right, so we're taking a vote now on giving permission to allow our risk management department to release the bid by the end of this year for on our on-site clinic services. Any other questions or discussion? If not, all of you in favor of that, please say aye. Aye. Any opposed? All right, thank you. Now we're going to get a report, our actuarial evaluation of our OJI program.
Every 2 years, we employ the services of Select Actuarial Services to do an actuarial review of our on-the-job injury program. And they look at our OJI claims and our existing worker comp claims. They tell us kind of where we're being and actuarially where are we going, so that we know how things are trending inside of the OJI plan. So if you look at this, you'll see that July 1st, 2012 through that fiscal year is reported, and then beginning July 1, 2014 through this fiscal year, what can we expect to see? And the results are very favorable. Our monthly medical cost per employee 2 years ago was $6.92. We are now at $4.89. Our projected monthly indemnity cost was at $1.39. We are now at 89 cents for current period. The combined cost has gone from $8.32 to a lower number of $5.78. And combined yearly cost per employees has decreased from $99.75 to $69.33. Our expected average monthly employee count for the 12-13 year was 5,871 employees. For current fiscal year, it's 6,174. Our projected loss for 2012 through 13 was $586,000 compared to current fiscal year of $428,000 inside our OJI. We are actually, in some instances, seeing a higher number of claims, but we are seeing lower costs associated with those claims. So that means that we're getting them in the care, in the right level of care, and getting them back to work quickly. I can tell you that we do not, when I first came 4 years ago, I had an opportunity to have a lot of interaction with employees about the OJI program. It was still a couple years new at that point, and there was some hesitancy and a learning curve there. I do not receive those calls anymore. So we're doing something right, both financially and how we are executing that program as well. So for the workers' comp, we currently have 14 open worker comp claims. Just as a point of reference, in 2012-13, our yearly cost per 1,000 of payroll was $9.18. Current fiscal is projected at $8.70, with yearly cost per employee being at $3.49 previously, and current year is reflecting a projection of $335 Projected ultimate loss in the 12-13 year was $2,049,000. This year, it's $2,071,000. Now, we have those that will be lifetime, that we'll continue to see those. We'll have those that will continue to close out. I think I said in the last meeting, we were hovering a year ago around 19 or so claims. Now we're starting to hover around 14. But they can open and close. We usually don't see a shift of more than 3 in the count. So we'll continue to see that workers' comp cost lower during each actuarial review period, or we would expect to.
Okay, any questions regarding this report from Ms. Street? I mean, you can notice we've only got 14 open claims, but these are lifetime opportunities for several of those, so it's producing cost in excess of $2 million. And it doesn't appear to be declining as quickly as one would think, but.
No, but also within this year as well, some of that increase has contributed as, some of these claims may lie dormant for a period of time, and then they could have some substantial costs associated. So you may see this type of fluctuation as well occurring. Correct. It will depend on how the claim originated as to how it will be reported. Correct.
Okay, any other questions on that? But it's obvious that the OJI program is working good, and one of the good things is we're not getting complaints and concerns
Correct.
routinely being addressed or questioned at least. So that good job on the administration of the plan.
Sir?
Is there any other business that we need to address? Okay. Those of you that have served on this committee for a long while, and some of you even much longer than I have, we just want to say that how much we appreciate the service of all of you, first of all. I mean, it is a very important committee, and we have some difficult decisions to make from time to time, but we have had outstanding membership from all of you, and we particularly want to recognize one of our outstanding members who is not going to be with us again, and that's Mrs. Joyce Ely. And we just want to say, Joyce, thank you again for your professional contribution to this committee and everything else you've done to support and serve Rutherford County. You have been a tremendous asset and a blessing for all of us to have known and to have been able to work with. So thank you, and we wish you the best. Anyone else have anything they want to say today? When is our next meeting? Next month? All right. So sometimes we don't meet if we don't actually have something, but.
Oh, that won't be for a while, I don't think.
But she thinks we'll be meeting every month as scheduled,
Yeah,
all right?
October, actually. We don't meet during open enrollment, so.
All right, if there's no other business, then we are adjourned. Thank you very much.